Hi, my name is Paula Brown. I'm a student nurse practitioner, and I'm here today to do the head-to-toe examination. This is my patient here for video purposes. I have allowed him to empty his bladder. We did vital signs, 120/74, pulse of 76, respiration 16, temperature 98.0. He went ahead and put on a pseudo gown. What I'm going to do first is I'm going to do an inspection of the head. So I'm going to look at the skin, and I'm going to look at the symmetry, and I'm going to make sure that everything's okay with the skull, that there's no deviations or anything. I'm going to now palpate the scalp, and everything appears to be fine. I'm going to move over to the face. I'm going to palpate the facial bones. Everything is fine there as well. I'm going to move to his temporal area. I'm going to move to his TMJ, his temporal mandibular joint here. Can you open and close for me, please? Close, open, close. I don't hear any popping or clicking. I'm going to palpate his sinuses. Any pain there?
No.
Okay. So everything checks out fine with his head. I'm going to go ahead and move to his ears now. I'm going to inspect both of the ears, make sure that they're symmetrical. I'm also going to feel the auricles, and everything appears to feel fine. I'm going to do what is called the whisper test. We're going to check his hearing. Some of this video may coincide with the cranial nerves, but we'll move forward from there when we get there. So what I'm going to do is I'm going to cover one ear, and I'm going to whisper, and I'm going to see if he can tell me the word.
No.
Okay, so he is unable to pass the whisper test. Bilaterally, he does wear hearing aids though. So what we're going to do now is we're going to inspect inside the ear canal. And I'm going to pull up and back on the auricle. And I'm going to look and make sure that I can see the eardrum and that it is pearly gray. The tympanic membrane is intact. So now that we're done with the ears, we're going to move to the nose. I'm going to look at the nose, and I'm going to see that it is symmetrical. I'm going to see that the septum is midline. I'm going to go ahead and take a look up into the nose. The mucosa is pink, the terminates are fine, and there is no deviated septums. So from here, we're going to move to the mouth. And what I'm going to look at first is I'm just going to look at the symmetry of the mouth and look at his lips, make sure that everything is fine. If you can open up for me, please. A little close, yeah. So I'm looking to see now that the mucous membranes in there are pink. Lift up your tongue, let me see the floor of the mouth, okay. And what we have here is, he does, you can close your mouth, he does have a plate, and so he is missing some teeth on the top, some teeth on the bottom. There doesn't appear to be any caries. The mouth odor is fine. Okay, so go ahead and open up. We're going to look in the back there, and we see the both the tonsils, the uvula is fine. Stick out your tongue and say ah. Okay. Ah. Okay. And his gag reflex was good. So now that we've got this portion of it done, we're going to move and do the do the cranial nerves before we move on to the neck, since we're still up here in the head. So Mr. Griffey, what I'd like for you to do is I'd like for you to close your eyes. I'm going to give you 2 items to smell, okay? And I would like for you to tell me what they are, please.
Coffee,
What's the second one?
lemon,
Okay. Little faux pas there. Anyway, okay, so what we're gonna do now is we're gonna check the optic nerve. Okay. I'm going to look inside to see if I can see the red reflex. So. Okay, very good. I can see the red reflex, the optic nerve, the optic disc. Everything appears to be fine with that. We're going to do what I'd like for you to do now, Mr. Griffey, is cover that eye for me, okay? And I want you to tell me when you see my fingers come into vision.
Now.
Okay, cover the other eye, please. Tell me when you see my fingers come
Now.
into vision. Very good. All right, so now we're gonna check his cardinal field of gaze. So I want you to follow my finger, please. Okay, very good, back to center. So everything was good with the second cranial nerve, which is the optic nerve. Now we're going to do the ocular motor. So we're going to do the consensual. And we're going to do the direct. Okay, that was the direct. The consensual, I'm going to shine it in his left and look at his right. I'm going to shine it in his right and look at his left. And everything turned out well with that. So the trochlear now is what we're going to do. We're going to take the finger. We're going to make sure that he can follow it. You follow my finger just with your eyes, Mr. Griffey. Okay, very good. So that test passes well. So what we're going to do now is we're going to do the trigeminal nerve. And in doing that, I would like for you to scrunch your forehead for me. Okay. And smile. Let's see. Clench your teeth for me. Clench them. Okay, very good. All right, close your eyes. And I want you to tell me if you feel dull or sharp.
dull, sharp, dull, dull, dull.
Okay. Mr. Griffey suffered a stroke in 2010, so that's why we got some residual here. When it was actually sharp, he was saying that it was dull. So now we're going to do the facial. Let's see, where do we need this? So what I need for you to do now is I would like for you to look at me, and I would like for you to smile real big, stick your tongue out. Okay. Puff out your cheeks like a puffer fish. Puff out. That's good. Okay. Okay, so we had already done the whisper test, so now what we're going to do is we're going to check for air bone conduction. You tell me when you no longer hear this.
No. No.
Tell me when you no longer hear it.
No.
Okay. Okay, for sake of time, we're going to assume that it's the same on the other side. Mr. Griffey does wear bilateral hearing aids, as I said. Okay. So, moving on. We've already looked at the uvula. We've already done all of that when we did the mouth. So now what we're gonna do is we're going to, I'm gonna press my hands down on your shoulders here. I want you to shrug them up. Okay, shrug down. Okay. And that was fine. He was able to move the spinal accessory muscles. And for the vagus nerve, I'd like for you to take a deep breath. Cough for me. Cough. Okay, very good. So, and with the mouth, we also did the hypoglossal nerve, which go ahead and stick your tongue against your cheek here. Okay, do it against the other one. All right, very good. So that is the cranial nerves. Now we're going to go down to the neck. We're going to inspect the symmetry, and everything appears to be fine here. We're going to inspect the thyroid. What I'd like for you to do is put your head towards my hand so that we can inspect the sternal-mastoid muscle over here. Again, there's the sternal-mastoid muscle, which is fine. Now we're going to look at the trachea, make sure that it is midline and it's in position, so that looks fine. We're going to now do the lymph nodes. So we got the pre-auricular, we got the post-auricular, we've got the occipital, we've got the submandibular right here, and we've got the submental